Some cancers need specific radiation therapies to treat and kill the cancer cells. In a certain type of cancer chemotherapy, a drug containing boron-10 is injected into a patient where it only binds to cancer cells. The boron-10 containing tumor is then bombarded with neutrons, which induce a nuclear reaction producing alpha particles. The alpha radiation kills the cancer cells, leaving the surrounding tissue unharmed. One of the reasons smoking causes lung cancer is because tobacco contains radioactive polonium. That is why specific chemicals are used to kill the damaged cells. The equation you see here is a boron plus a neutron. When those two are combined, you are left with an alpha particle and a lithium.
So, you've been diagnosed with cancer and your treatment will involve radiation. Many don't understand what this means. Most patients enter radioactive treatment with a fairly negative idea about radiation and its effects. We're here today to extinguish those negative stigmas and replace them with the facts. They may not be pleasant, but they are the facts.
And now for the unpleasant news. Side effects and the aftermath of radiation vary from patient to patient. Some experience very few side effects, while others can have severe results. Some of the most common general side effects include nausea, vomiting, skin issues, and fatigue. A long-term side effect is the cancer returning. Certain forms of cancer have more specific side effects. If you have treatment on the head and neck, the side effects are dry mouth, sores, difficulty swallowing, stiff jaw, swelling, tooth decay, loss of appetite, and loss of taste. If you have treatment to the chest, side effects include difficulty swallowing, shortness of breath, soreness in the chest and nipple region, shoulder stiffness, a cough or fever, a fullness of the chest, and radiation fibrosis. If you have treatment to the pelvis, side effects include bladder irritation, incontinence, rectal bleeding, infertility, changes in menstruation for females, diarrhea, fatigue, hair loss, and skin irritation or damage.
As a form of aftercare, many different forms of medication are available to help cope with pain. For moderate or mild pain, non-opioids can be prescribed. A common non-opioid is acetaminophen or Tylenol. For more severe pain, you may be given opioids. These could be oxycodone, methadone, hydromorphone, codeine, or morphine. In some cases, other forms of medication are given for varying forms of pain. Steroids may be prescribed to help deal with swelling. Be sure to talk to your doctor first. If nerve damage occurs, anti-seizure medication could be given.
If you are pregnant and require radiation therapy, then it is possible that your physician will postpone the procedure until you give birth. If this will present too much of a health risk, then the proper warnings and risks will be discussed with you promptly. While minor dosages of radiation will most likely not harm your baby, such as radiation released during an X-ray, direct exposure or more extreme exposure from radiation therapy will hurt an embryo or fetus. This can lead to miscarriages or birth defects.
And these are our sources.